Yeah, I'm Dr. Soutrik Mukherjee. I'm working here as a consultant joints, spine, pelvic surgeon. So basically, we had this patient who hailed from, I believe, Mirik. Okay, she has been suffering from knee pain for a prolonged period of time, and like it's basically she was having an osteoarthritis of both her knees, and the knees were totally bent. If you've seen the video, she cannot even walk straight, and it had to be operated. Basically, the main thing is that we lack a lot of awareness in people staying in this part of the country. Eventually we could convince her, and she underwent a bilateral knee replacement. So that was basically the operation, where we kind of changed the damaged part of her knees, and we also realigned her knees. Her knees were bent, we made them straight. And the best part is like the painless life that she's living after the surgery. Okay, she's herself surprised, and also people staying nearby at her place, at her residence. A lot of people in the hills suffer from osteoarthritis, right? So they are surprised, or like they are getting aware of what the situation or what things are. So knee replacement is basically a very a routine and a safe surgery that has to be understood by the people, because there's a lot of apprehension, a lot of misconceptions that people usually get bedridden, they cannot walk, their life becomes difficult. So these are all myths. It's a very routine surgery, it's a safe surgery, a very rewarding surgery. Patients usually do very well if done in the right hands, and of course if there's an indication. So and more importantly, if you see the x-rays and the condition of the patient, this patient, so this was a very advanced arthritis. We usually recommend patients to do it at a much earlier stage than this, because it only increases the complexity of the operation and the duration of rehabilitation and the getting back to normal life. An easy thing becomes more complex if you just keep on neglecting it. So it is very important that you consult your orthopedician or the joint replacement surgeon at a much earlier stage of when you're having a problem, and you get it addressed at an early stage, so it becomes easier for the patient as well as the doctor itself. I won't say it's a big achievement. It's like an eye-opener maybe for the people staying nearby, that such things are being done here. We see a lot of patients flying out stations, different states, for seeking these things when it is available right over here. Maybe for this case, it was a very complex case, to be honest. The complexity of the joint, it had to be addressed, and in that way, maybe it's a good thing that such complex primary joint replacements are being done here. It's a good thing for the patient, people who stay here and the surrounding regions from where the patients come. But otherwise, more than an achievement, I think it is more important to spread the awareness that such things do exist in Siliguri, and more importantly, we have this government facilities and the government schemes and health schemes. Even though like these operations are a bit expensive operations, so the government also provides certain schemes by which you get it almost at a very nominal price. So that is one advantage that the patients of this state can avail to get such treatments done. So this is a message that has to be, reached out to people, for them to know and understand and seek the benefit of it.
इतना अच्छा ऑपरेशन हुआ, इतना अच्छा ऑपरेशन हुआ। अभी तो चलने भी लगा हूँ, मैं चलता हूँ। डॉक्टर भी इतना अच्छा है ना, इतना प्यारा डॉक्टर है, जो भगवान जैसे सोचने से होगा। डॉक्टर लोग, यहाँ का स्टाफ लोग जो भी है, सबको हमारा तरफ से नमस्ते।